Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Lance Freeman. We appreciate you being here. We are talking about avoiding sports injuries, being the time of year, summer sports coming up, and activities outdoors as well. We want to know what the most common injuries are that you see, and then also how to prevent them.
Yeah, this time of year, the most common injuries we see are soft tissue injuries, musculoskeletal, particularly sprains, strains that lead to tendinopathy. The most common being ankle sprains. Activity-related knee pain is very common, and sometimes we see that with patellofemoral syndrome, patellofemoral pain. These are more commonly caused by biomechanical problems, more common in females, usually secondary to lateral kind of tracking of the kneecap, and also less commonly, but sometimes more important to the athlete, is ACL tears or anterior cruciate ligament injuries, mostly because these typically require surgery and long rehab, possibly 6 months, so you can lose your season. So sometimes we have to deal with the sports psychology of kind of having your season taken away from you at that age, but with minimally invasive surgeries and how advanced things have become, we have really good results in regards to you can expect to get back to your previous level of competition following surgery.
Nice.
As far as trying to avoid the injuries, the ankle sprains, I think that as well as all of these types of injuries this time of year, go back to a really good physical examination and history. So it becomes really important that physical examination, the pre-participation physical examination, looking for risk factors that would lead you to believe that you might be at risk for having some of these injuries.
What are some red flags maybe that a sports injury needs more than just some rest and ice?
Well, if it swells very quickly, like within that first half hour to hour, where you get a lot of swelling as well as bruising, because that can be a indication that there's been a tear of the muscle, as well as if they can't walk, can't bear weight initially, and then in the office similarly, that type of patient that can't bear weight, can't walk a few steps, needs an x-ray.
Now, when talking about parents maybe signing their child up for summer camp or sports, or grandparents signing them up, is there something they should watch out for to really make sure their child is playing safely?
Well, I think if you're going to a sports camp and your child is relatively inexperienced with various sports that they're going to be involved in, if you can know kind of like the schedule and beforehand, you can actually do similar type of things, pre-participation type of training, to get ready for that type of a new kind of endeavor, as well as knowing like your list of things that you need to bring as far as equipment. So having well-fitting shoes, particularly if you're a runner, if they're planning on doing outdoor activities on unlevel ground, hiking up, down, making sure that you've got good hiking shoes that fit, and actually breaking them in before you, go to the camp is a good idea, rather than having blisters and pressure sores and so forth.
Sure, no, that's interesting. Not only are you a sports medicine doctor, but also an emergency care physician. Is there a way that all of us can balance out, staying active without avoiding injuries?
Well, I think that what we see in the emergency department is relatively simple stuff to avoid. As far as a lot of it is dehydration, so just paying attention to staying very well hydrated. And then, this time of year, as you get towards summer, paying attention to the humidity and the heat. That's another, thing to keep track of with these types of camps that you mentioned, is, making sure that they're doing their activities when it's relatively cool in the morning and trying to avoid the midday, particularly, knowing what the humidity is and what the temperature is going to be. And so, those things you can avoid. Most of the trauma is, it's more accidents and hard to avoid that type of thing.
Sure. Are there any, warm-up or cool-down tips that make a difference in preventing an injury?
Yeah, I think that, doing trying to do something that's sport specific, depending on what it is. You know, every person, every athlete is different, and kind of separating out into age is also helpful. You know, to sit down with the athlete and kind of talk to them about what their goals are as far as the sporting event versus maybe just starting an exercise program. So I think that doing some type of stretching before as well as after, we always forget about like cooling down as well as doing stretching afterwards once our muscles are warmed up. So I think that initially you just want to kind of either do like brisk walk, jog, or something that's related to what you're gonna, if you're competing, so that type. And then to also do, that's dynamic stretching, do some static stretching, which is just, you can even just do your hamstrings and your Achilles and gastroc just by up against the wall, kind of stretches. And then, you know, the next step is doing your cardio. You know, so doing these stretches before your cardio, and then at the end, cooling down and doing stretches afterwards.
Well, you touched on it just a minute ago, but talking about May being Physical Fitness and Sports Month for people who are maybe sedentary, who want to start an exercise routine or become more active in these months. What's your recommendation there?
Well, that's you know, complicated as far as the main thing is to make sure that you don't have undiagnosed, you know, coronary artery disease. And I think that you really need, it's really important to get with a physician that's going to do the tests needed so that you can safely start your program. But you know, if you have family history of coronary artery disease, risk factors for it, you know, in other words, other comorbidities like hypertension, diabetes, cholesterol, that, you know, there may be a need to do not just an EKG and maybe lab work, but possibly even, you know, stress tests prior to exertion, or even a referral to a cardiologist to clear you beforehand if you're really sedentary and have that family history of coronary artery disease.
Now, are there other mistakes maybe that someone might make if they're just starting to work out?
Well, I think that the biggest mistake is just thinking that you're, you know, if you competed when you were, you know, young, you were in high school, and then you've taken a fair amount of time off and are trying to get back into it, is just thinking that you can jump right back in and kind of doing too much, overdoing it. You see a lot of overtraining, overuse injuries, and similarly not keeping up with your hydration status as well.
Now, at the beginning you talked quite a bit about a lengthy list of some of the injuries you see. Are there some that are the most preventable that do end up in the ER room?
Well, I think the ER, I think about this time of year, the possibility of getting heat illness and dehydrated, as well as, you know, sometimes doing your workouts in the morning and unprepared for it being quite cool, and you can actually have hypothermia. And then, you know, traumatic injuries are difficult to kind of avoid, but
want everybody to hopefully stay safe. Well, we appreciate you being here. Lots of great advice here. If you want to learn more about protecting yourself and your family as you get more active this time of year, just go to the Hot Links page, and that's at the top of WNEM.com. We'll be back in just a moment.